Welcome back to our channel. Today, we're exploring a groundbreaking study on treating appendicitis without surgery. Can antibiotics alone effectively manage this common condition? Let's dive in. Here's the bottom line. For adults with CT-proven uncomplicated appendicitis, initial treatment with antibiotics showed a 27.3% recurrence rate at 1 year and 39.1% at 5 years. Over 5 years, the overall complication rate was 24.4% in the surgery group, compared to just 6.4% in the antibiotic group. Let's break it down. Published in 2015, the APPAC trial investigated whether antibiotics could be a feasible alternative to surgery for appendicitis. Historically, appendectomy has been the go-to treatment. But with modern medicine, there's growing interest in less invasive options. In the APPAC trial, 530 patients with CT-confirmed uncomplicated appendicitis were randomized to either undergo surgery or receive antibiotics. This was an open-label trial, meaning everyone knew which treatment they were getting. The primary outcomes were different for each group: successful appendectomy for the surgery group and avoiding surgery for the antibiotic group. The results were intriguing. For the surgical group, 99.6% successfully had their appendix removed. Meanwhile, 72.7% of those treated with antibiotics avoided surgery in the first year. This did not meet the preset non-inferiority margin, but it's worth noting that a majority managed well without surgery. Looking at the 5-year follow-up, the recurrence rate of appendicitis in the antibiotic group increased to 39.1%. Despite this, the overall complication rate remained significantly lower in the antibiotic group at 6.4%, compared to 24.4% in the surgical group. Plus, those treated with antibiotics had less sick leave and lower pain scores post-treatment. But it's not all straightforward. Critics of the study highlight that most surgeries were done via an open approach rather than laparoscopic, which might have inflated the complication rates for surgery. Also, the triple antibiotic therapy used might have been overly aggressive, raising concerns about antibiotic resistance. As of now, there are no new guidelines that specifically reflect these findings. But the APPAC trial opens the door to antibiotic therapy as a valid first-line treatment for uncomplicated appendicitis, especially for those looking to avoid surgery. In conclusion, while antibiotics don't completely replace surgery for appendicitis, they offer a promising alternative, especially for those with uncomplicated cases. Always consult with your healthcare provider to determine the best treatment option for you. Thanks for watching. If you found this video helpful, give us a thumbs up and subscribe for more updates on the latest medical research. See you next time.